Good afternoon. Welcome to Mental Health and Vulnerable Adult Task Force. It's good to see you all here. We've had a busy morning, but we're doing well, and we're looking forward to all of the conversations this afternoon. The first thing up will be the Department of Education. And so if you'd like to come up and give your testimony. Please just introduce yourself and we'll go from there. Thank you.
Thank you, Madam Chairman. Megan Dagenfelder, State Superintendent of Public Instruction. With me is Dickie Shaner, Chief of Staff at the department, and Nathan Tajeski, our Chief Innovation Officer. So a couple of topics to discuss with you all today. Thought we'd start with the first one on the agenda on discipline. And so just to give you a high level, and then this is something that Chief of Staff Shaner has really been digging into as of late. This was a topic that I brought to the Joint Education Committee for them to consider as an interim topic for this interim. And that's because this is an issue that we keep seeing grow more and more in our schools, and something that we're hearing from teachers. One of the top 3 concerns we heard that came out of our Teacher Retention and Recruitment Task Force and our statewide teacher survey was behavioral issues from students. And of course, we've seen, just a myriad of back and forth at the federal level on this topic as well. We saw in 2014, President Obama issued federal guidance that essentially moved away from it created disparate impact, and this notion that if one population of individuals is treated differently disciplinary-wise, then that can be construed as racism. And President Trump in 2018 rescinded this guidance, and then just in a few months ago issued an executive order that further did away with disparate impact, removing all of that and getting back to a place where, again, we are not judging any student by their race or ethnicity. And so I'll pass it off to Chief of Staff Shaner to share a little bit. We've also begun looking at other states and what they're doing in terms of discipline policy, especially statutorily. We've seen Florida, Texas, North Carolina, or South Carolina, pass legislation that returns some authority to teachers in the classroom. So Mr. Shaner, if you'd like to share more information.
Thank you, Superintendent, Madam Chair, committee members. To add on to the superintendent's remarks, we are bringing this to you here today because we're starting to look at mental health in schools, trying more holistically, and what are some of the other things we're doing related to that topic, 2 of which are student discipline, student behaviors, as well as school nutrition, which we're starting to work on too, because it's all related to student behavior. And this item in particular is something we presented on at the Joint Education Committee. And we've all heard anecdotally the concerns that our educators have about the issues that children are bringing into classrooms and the difficulties they're having controlling the learning environment. So you can see some national data we put in that memo just at the top that over the last 10 years, reports of student verbal abuse of teachers have more than doubled. Acts of disrespect other than verbal abuse have more than doubled. And a metric measured called widespread disorder in classrooms has increased over 50%. So it's not just a Wyoming issue, it's a national issue. And so looking at some of what other states are doing, we presented some content, particularly from Florida, on what we would characterize as empowering teachers to control the learning environment in their classroom. And that is allowing them in statute to create a code of conduct for their classroom, to establish those sort of matrices of discipline for the different behaviors, and requiring in law that administrators back them up on that, because that's something we hear a lot, is that the teachers know what's right, want to take those disciplinary actions, but that the administrators often aren't able or willing to sort of back them up on that. And so trying to bridge that gap through statute is what we're working on. We do believe there will be some draft legislation on student discipline at the next Joint Education Committee meeting, but we thought it was appropriate to bring it to you because we do feel like it fits under this mental health umbrella.
Thank you. Any questions for the superintendent or the chief of staff? Co-chairman Barlow?
Thank you, Madam Chairman. So I just want to confirm, I looked at the interim topics. Education is taking this up, and I've got a good colleague who's on education as well. Is this all going to be part of the recalibration discussion at some level as well? Do you have a sense of that? I know you're not sitting on that committee, but is that part of their discussion, or do you have any sense of that? Thank you, Madam. Thank you, Madam Chairman.
Madam Chair, through you, Senator Barlow, the topic of mental health, I know specifically will come up in recalibration related to elementary school counselors, because that was an issue in the district court litigation that the courts pointed out that the consultants have looked at. So I think that will probably be the opening for a larger discussion about mental health and recalibration.
Thank you. Any other questions? Okay. Would you like to continue?
Yes, thank you, Madam Chairman. I'll now bring up Dustin Brown to the table as well. Many of you may recognize him. He has been serving as liaison on the Mental Health Task Force and has put considerable time into all of our work around mental health the last 2.5 years that completely is beyond the bounds of his JCQ and job duties. And so I really appreciate all of Mr. Brown's work on this topic. So as we talk about mental health in schools, this was one where even when I was campaigning for this position, we know, of course, that's why this task force was created, that Wyoming has disproportionately high rates of mental health issues and suicide. That's why we're all here today. We also know that exists with our youth. And when I met with districts across the state while campaigning, 2 issues that district superintendents would share: teacher shortage and mental health of students. So we know that this is an issue that we need to address in the state. We also know that this, as I mentioned previously, behavioral issues of students, one of the top 3 reasons why teachers would consider exiting the classroom. On the other hand, we also have a lot of breakdown of trust between our parents and our schools, especially around topics of mental health, social emotional learning, those type of things. And so this weird juxtaposition between the concern of mental health for students, but also the concern of parents in what environment their child is involved with in terms of mental health provision. And so knowing that this is an issue, the approach that I've taken since coming into office was how do we balance those and how to ensure that we are identifying students, but then we are referring them out and we are working hand in hand with parents all along the way. Because the fact of the matter is that our teachers, our schools should not be mental health providers. That's not our role. We're there to educate. And so how do we then make sure that children are not falling through the cracks, but we're not overstepping our bounds beyond that of rights of parents and referrals? And so what we created was what we refer to as the GRIT framework. And this is all about growing resiliency in our students across Wyoming. And the principles that we brought to the table with this were all around, number 1, parental rights, first and foremost. Number 2 is about specialization and efficiency. Again, realizing that teachers, we need to allow them to do what they do best, and that's to teach. And then also that intervention is best referred out. So again, that same premise of making sure that we are referring kids with their parents for those assistance. So the 3 things that the framework really is composed of is prevention, identification, and referrals. And so I thought that for the committee to catch you up on what those 3 areas are and some of the initiatives that we've undertaken, either through use of COVID dollars or other pilot opportunities in the state and how those are going. So the first one I'd like to touch on is around prevention. Of course, we all want to prevent in any way that we can before we get to an issue with a child. I firmly believe that the way that we're systemically changing education and ensuring that students are educated on a student-centered approach will help mental health issues, will help attendance issues. We have to shift this idea of educating students one size fits all to one where there's pathway options, to one where we are meeting the student where they are, that makes them excited to go to school and to learn. And so with prevention, we're talking about all of our pilots around student-centered learning. So that's creating more competency-based learning, and you may be familiar with the Wyoming Future of Learning partnership with the Governor's Office, the State Board of Education, and other partners. project-based learning, getting kids out of the classroom with work-based learning. I think all of these things are going to help in prevention of mental health issues that we see in our students. So next, we go to identification. How are we ensuring that we're identifying those children who need referrals and support? And so one large-scale program that we have piloted across the state is the AWARE program. The AWARE program is one where there are actually bodies in the schools, professionals that are identifying students and then partnering with parents and with those mental health providers. They're kind of that conduit. They're really a coordinator at the school level. They're not providing the mental health services, but they're really identifying and they're coordinating with parents to be able to do that. We've seen significant success in the districts that have piloted that. And that was one that we brought, and I'm sure you'll hear this afternoon as you review bills. That was in a bill to fund the AWARE program this last session. The cost of that to scale statewide is $13.2 million a year. One approach we were taking with that in the bill last year, you may recall, was to pull from the the 2-year mental health grant that was appropriated in 2024. But again, that bill did not pass committee, and I believe this task force will review that later today. So happy to go into more details of what the AWARE program is. I also want to touch then on care coordination, which is the referral aspect. Care coordination is something that we used ESSER dollars to fund. It was only for a limited time and was about to time out, but the Public Health Division has added an additional 2 years of funding for care coordination. We have 39 of the 48 school districts that are utilizing it. And essentially what it is just a service that you can call into, and they will help you navigate what providers are in your area, or maybe we're dealing with a really small community, what virtual options exist, those type of things. So it's really that conduit for students as well as teachers and employees of the school district to utilize. And so that's been popular, and we've been able to keep that going for an additional 2 years. The last program I'll mention is called BAR. And this is something that we use some remaining COVID dollars on to pilot in a few districts, 4 school districts in the state. What BAR really is it is about identifying good and bad, what's occurring with a student. And it's a little bit difficult to explain, but what it is it's really those professional learning communities that we know, but it's doing that based on the whole child. And so the teachers are getting together, maybe a particular student has a different teacher for math or for science or for social studies. They're coming together and saying, well, we noticed that this student was absent today, or this happened at home. How can we help to better support them? Or they're really excelling at this particular career pathway. How can we help to leverage that more? There have been a lot of evidence across states in the country of this being successful in terms of better improving outcomes for students academically as well as attendance. And again, it's less about providing mental health services. It's more about just how do we grow resilience in our students. And so that was something that we've discussed as well. I know that Senator Brennan is very familiar with the program, and I'm sure could speak to it. So Madam Chairman, that is a very quick overview of the framework and kind of our principles behind how we've taken on mental health and those things that we've piloted. All of these things do not have long-term funding. And so they've been piloted projects. I think the best way that we know if something works is to pilot it and ensure that we see the results we're desiring. So those are the programs we've been working on. Also wanted to just briefly mention some of the things we've also begun to look into, because as Chief of Staff Shaner said, mental health, the behavioral issues of students is more holistic than just providing mental health services. And so we've begun to look into nutrition. Of course, we know that if none of us had a lunch break today, we probably wouldn't be performing at the level at which we are now. And so looking at how does nutrition impact behavioral issues of students? We've seen some school districts in the state that have done some study around that, so we're looking into that along with the First Ladies Initiative. One program that we're also focusing on at the moment is the Wyoming Farm to School program. This was entirely funded through USDA, and unfortunately that funding is going to be ending. But what that is a coordinator position within the Wyoming Department of Education that is working with our ag producers in the state and coordinating them with school districts. It's a win-win because producers are able to sell their products to the school districts, and the school districts know where to find these local producers. Really great program that unfortunately we'll be losing funding for here in Wyoming. And along with nutrition, cell phone policies. This, of course, was a bill that was brought to the legislature this past session. I still believe that the state should look at a bell-to-bell cell phone ban. I think that this leads to many of the mental health issues and behavioral issues that we're seeing in schools. And while many districts have policies around it, we're still seeing data from parents that look at their child's cell phone usage, and the amount during the school day is startling. So again, Madam Chairman, that's a really high-level overview of the things that we're working on. We're happy to provide further detail on that. And as I mentioned, Mr. Brown has been intimately involved in all of those programs. So with that, would stand for any questions.
Thank you, Superintendent Degenfelder. Any questions? Senator Brennan.
Thank you, Madam Chairwoman. Could you just maybe briefly, and very, very briefly, what are maybe some of the top 2 to 3 differences between the AWARE and the BAR, and just maybe touch on that a little bit for me?
Sure, I'll have Mr. Brown tackle that one.
Madam Chair, Senator Dustin Brown with the Wyoming Department of Education. The big differences between BAR and AWARE is really when we go back to that identification, that recognition, that referral. BAR is really good at a baseline, reducing the overall prevalence of need within the school setting. BAR is like your foundation, where AWARE is really there to, when that need is identified, that we can coordinate that externally through a vehicle that utilizes the familial structure and has the parents guide that treatment path with AWARE. So AWARE is really focused on those Tier 3 clinical intervention services, where BAR is really focused on the foundational aspect of the MTSS pyramid, that Tier 1 level of services. But they BAR kind of feeds into AWARE, and then AWARE kind of feeds back down into BAR. So they're very complementary, but they have kind of a unique purpose when you look at them collaboratively.
Senator Brennan, follow up.
Yes, thank you. Are there any schools that are using both programs at this time, or are they being piloted?
Madam Chair, there's no overlap currently within the state. The 7 AWARE districts don't overlap with the pilots for BAR. The pilots for BAR in other districts.
Any other questions for the superintendent? Chairman Barlow.
Thank you, Madam Chairman. So I just want to clarify, both projects are at risk of no longer being there, pilots, because of funding in this next. I just want to know when that drop dead date is, based on no federal funding, and if there's no state funding, these are at jeopardy. So I think I want to just make sure I understood that correctly. Thank you. Thank you, Madam Chairman.
Madam Chair, Senator Barlow, that's correct, and all 3 of them actually. And so we have the AWARE, that's that person that's coordinating. We have the baseline BAR that's training teachers on how to identify and get them to that coordinator. And then we have the third one, care coordination, which is that call line to help facilitate needs. So those are the 3. They have varying timelines of funding, but do you want to speak to that?
Madam Chair, Senator, the care coordination we have through the end of 2028 now, based on the connection that we were able to make with the Public Health Division on that. The first AWARE grant ends in October of this year. The next AWARE grant, so we have 3 AWARE grants total. The second AWARE grant ends in October of 2026, and our final AWARE grant ends in December of 2026. So that's the timeline for those. BAR is entering into the second year of its third year for the 7 participating schools that are working with BAR currently. The BAR is a 3-year commitment, so that's kind of what we're looking at for BAR, and then it's a standalone project.
Thank you. Any other questions? I have a few. Okay, and I told you I would wait, but I have a few right now. First off, I would like to know what the 7 districts are that are participating. And one of the things that I was wondering is, you had said about training the teachers and stuff. Is that going through professional development days, or because a lot of times teachers are like, I can't handle one more thing. I just can't handle one more thing. And it's like, this is to make your life better. And so if there's specific training and follow-up, things like that, and also in my mind, I'm picturing this as being a skills training for the teachers and staff so that they can make that a part of every day, so it doesn't really need funding unless there's follow-up training, or maybe I'm missing something on that. And then with the food program, we talked about food just a minute ago. I know different programs through different administrations come through on what's good and what isn't, but I thought federally that all school districts were funded through the Department of Agriculture. They're no longer going to do that?
Madam Chair, on the 7 districts that are participating in AWARE, in our first project, we have Campbell 1, we have Fremont 1, and we have Park 1. On our second project, we have Carbon 1, Sweetwater 1, and Uinta 1. And then on our third AWARE grant, we have Sweetwater 1 and Sweetwater 2 that are participating in that third grant. So with that, also from the training, before I hand it back over on the nutrition piece, BAR and AWARE, BAR is really a culture shift. It's very training heavy. It's very professional development driven. And what you're doing is you're really kind of shifting the culture to a PLC model, like the superintendent said, but that it focuses on so many aspects, good, bad, what's going on. We're really looking holistically at the teacher-student relationship, the student-student relationship, and the parent relationship with the district through BAR. AWARE is a little bit more of a traditional model in that we provide funding as part of the AWARE grant funding model. There's approximately $100,000 in funding for each school district per year. And we really piggyback on things that already exist. Jason Flatt Act, with the suicide prevention training, but instead of just targeting the educators, we target the Jason Flatt Act for everybody working under the school district umbrella for signs and recognition. We work within the MTSS structures. So, Campbell County School District 1 utilizes HOPE squads. We reinforce what they're doing with HOPE squads. We reinforce sources of strength and things like that. Not anything that we specifically mandate at the state side, but we support what's already working in the districts under their footprint and under their umbrella to enhance and refine and help them make better with those resources. So thank you.
And Madam Chairman, I would just add on to that. So AWARE is long-term because you're hiring individuals that are those coordinators between the parents and the school districts. The BAR program, as you mentioned, so that's a 3-year training program for a school. After that, it's just, really maintenance, but really, so that professional development, it's that culture shift. And so it's 3 years of intense training for those schools. And then they would be off of the training, for lack of a better term. In terms of nutrition, so I was just mentioning the Farm to School program. So that had been funded, just that program that was between our producers and our school district. Just that coordinator. So it's just one individual, limited additional funding. It doesn't do anything in terms of funding producers or districts. It's really just that coordinator position. And so that's what will be eliminated going forward.
And I have a follow-up. With with this training, because working in the school district for quite a few years, these wonderful things would come through and we'd all be trained. Well, 3 years down, new employees, new superintendent, and they were forgotten. So this will be put in some kind of education rules or policy or statute so that it is a required training for new employees, or how will that work?
Well, Madam Chairman, I think that that's part of the problem, is that we've, just had this very general approach with mental health in schools. And so even in 2024, the 2-year, $10 million grant that the legislature passed, it was wide open. And so we have school districts that are spending on all different types of things. And so how do we really have something that's going to stick and that we know works? And that's what this whole approach has been about, of we need to pilot, see how this is actually impacting our districts, and in creating something that we believe in. Because right now what we're doing, it's not working. We can do better. And so that's why this approach, but we would need to, as we brought last year with legislation, look at a way that makes this sustainable. But I think that it is a much better approach than the simple general grant that we give to districts. The other issue with that 2-year, $10 million grant is that short-term funding. And so we've heard from districts, well, we don't want to implement a long-term project because we don't know what funding is going to be. And so again, it just ends up being this constant cycle of new initiatives or short-term initiatives for districts. Whereas this, we know it's working. We have the data from districts that support that. So how do we create that at a statewide scale?
Thank you. Any
Madam
other
Chair?
questions?
Oh,
Yes.
Just to piggyback on Superintendent, with the AWARE grant, what we did was we had our first students enter that program in February of 2021. In that time, we've seen approximately 2,000 students through our AWARE grant since then. Our theory of change recognizes that if we can increase a student's capability to function and their ability to connect with their family, their peers, their teachers, our theory of change indicates that academic outcomes will follow. So what we're seeing is when we started, functioning went from the 30th percentile into the 80th and 90th percentile for the students we were able to serve. Social connectedness went from the 50th and 60th percentile into the 80th and 90th percentile as well. Right now, we're about a year into examining attendance and seeing if there's an impact prior to a student joining services, while they're in services, and then post-discharge of services. So I anticipate having that data in the spring when we fully analyze that, but that's where the AWARE work is taking us. I just wanted to say that because I know there's a few members of the task force that are just starting their time here, but that's been kind of the centerpiece to our AWARE work. So I hope that's helpful.
Thank you, Mr. Brown. Any other comments or questions? Yes, Chairman Barlow.
Thank you. So with that background of the funding ebb and flow and programmatic challenges that creates for districts, and we've got a member of recalibration sitting up here next to me. Do you think there's going to be an actual attempt in recalibration to build some out-of-the-model funding so that districts can opt in for some funding to actually make this a more sustainable long-term? Or do you think this is going to be in the model? In the model, it's a block grant. Outside, if you do something outside, then you have more latitude to say, this is what we want. We think it works. We know it works, et cetera. So do you have any comment on that, Superintendent? Or you don't have to try to presuppose what the recalibration committee is going to do because they don't know what they're going to do either. But I guess, do you have any thoughts about, how that might be set up in a way that would give what you think is, I think, effective work and good work, give it some sustainability? Thank you, Madam Chairman.
Superintendent.
Thank you, Madam Chairman. Senator, I wouldn't opine on the direction of the recalibration committee. I know that they will be addressing mental health, but how deeply they go into what programmatically that looks like, I don't know. That's why last session, Representative Larson and I brought this as a bill, because I do think that we're seeing that it works and that this is a better approach to that. And so that has been my preferred option.
And Superintendent, one more. Are we going to discuss that all nutrition and the effect that that has on students? Are we going to do that, or?
Madam Chairman, I don't have any data prepared today. This is something we just began visiting with the First Ladies Initiative and some particular school districts that we believe do have some data. And so I don't have that here for you today, but we're happy to provide that to the committee, and also happy to provide further information on how school nutrition programs are funded, the shortfalls that we see out of districts. There are high levels of debt, school lunch debt that districts face, and that the First Ladies Initiative has helped to fund, but we still have shortfalls there. We still have issues of children having differing meals depending on if they're able to pay. It can go from a hot lunch to a shame sandwich that is the pieces of bread and a piece of cheese in between. And so I do think it's an area that deserves some consideration and discussion.
Okay. All right, thank you. Chairman Barlow.
Thank you, Madam Chairman. Since you brought up the school food thing, Farm to School is a federal program, but we still have the state program, it's in the budget, obviously, that is the processing one for donated meat. And just clarify for that, I just want to be clear that the state potentially still has something going forward, depending on what the budget does. But the federal program is one way. Just summarize or clarify anything that I'm missing in that. Thank you.
Madam Chairman, Senator, that's correct. So that protein bill that was passed by the Wyoming legislature was around donated food that then the state, I believe, would reimburse up to 50% of the processing costs. So that is still a program.
Any other questions or comments? Thank you very much.
Thank you.
Okay, we're open for public comment. Anyone want to, please just come up and fill the chairs. Or chair. Please just identify yourself, and thank you.
Thank you, Madam Chair. Thank you, Chairman Barlow, Chairwoman Ottman, members of the task force. My name is Cheryl Foland. I am an LCSW in private practice in Rawlins, Carbon County. I actually have a couple of different roles that I will speak to today. First is as a citizen, taxpayer, private practice provider, small businesswoman, and then the other is I am the legislative advocate for the Northwest American Society of Addiction Medicine, legislative advocate. First and foremost is as the superintendent spoke to, we obviously support the code of conduct in the classroom. I work primarily with children with very difficult behaviors. What I hear from those children frequently is when asked, why do you behave this way in your classroom? And the response overwhelmingly is, because I can. That's disturbing to me. And when I pursue the questions from them, they do tell me, I can do what I want to. I can say what I want to. Nobody does anything. I have to go have lunch in the principal's office. It's quiet there. So behaviors are actually encouraged because there are no options available to these children from the disciplinary perspective. The other piece of it is I encouraged lots of training for teachers and staff. Behaviors aren't always mental health driven. Sometimes they're age appropriate. We have pushback. If they're not pushing back at certain ages, then I expect something to be wrong. We also have these wonderful folks in each of our districts. Each of our schools has school counselors. My question becomes, when we start adding administrative staff anywhere, who provides direct services? Where does that money come from? What is it going to look like? School counselors are a fabulous resource. They already can make referrals to the communities and to other providers and partnerships. We also do recognize, as a practice in the mental health community, there has been a lot of research come out in the last 3 to 4 years, some out of the University of Utah, which identifies a huge connection between mental health and the gut biome, the response of our gut in our behaviors, and that's children and adults. Food is essential. What we provide to the students is even more essential, and to those families as well. I am an advocate of our educational system. I am not an advocate, personally or professionally, of our school systems providing mental health care services. When we talk about screening, when we talk about testing, I believe John Wayne in one of his movies said, you throw enough lead in the air, you're bound to hit something. Well, there's an incentive when you start screening and testing to support programs. You want to find something. As a mental health provider for over 25 years now, I have seen at least 100,000 different screening and testing tools developed, implemented, withdrawn, and replacements. Finding something that works for identifying the behaviors is the behaviors. If I screen for something, there is not one of us in this room, much less children, that wouldn't screen for adjustment disorder. All of us. It's very short-lived. An adjustment disorder is that something has changed in your life and you're having a problem with it. Welcome to mental health. As the role of the advocate for the American Society of Addiction Medicine, one of the other pieces that has been talked about, including in mental health, is substance use disorder provider treatment. One of the challenges Wyoming has is we do not differentiate or track what master's level folks are providing from substance use disorder providers. The Department of Health has a program in place to certify, but our statute also allows that any master's level provider can provide substance use disorder services. Those may or may not be appropriate. We don't have a tracking mechanism as of this point to determine whether in fact the education and training they have received is appropriate. There are many things that we can do, and I appreciate the work that this task force is doing. One of the other pieces I would like to put a plug in is that anything we do legislatively also affects private business. Carbon County has 6 fully licensed providers in our county, 2 in Saratoga, 5 now in Rawlins. So I'm sorry, that's 7. Yet we have 2 school districts. So our tax dollars are going to be funding, yet again, administrative positions at a cost that could be that money transferred to actual direct services by the providers. Across Wyoming, the WAMSAC facilities provide excellent services. They, however, have state money. The majority of providers in this state are private, independent providers. We're for-profit. We're also a one-person office. We do it all, from janitorial to services to billing. We have lots of options in a community partnership. I would encourage this group to truly think through adding yet more administrative people, which is what coordinators are, We have resources available in the form of school counselors that could take on those positions and see where we go from there. Thank you for your time and your consideration. And I stand for questions.
I just wanted to say thank you for that testimony, and if you could please give me your last name again.
Certainly, it's Cheryl Foland, F as in Frank, O-L-A-N-D.
Okay, any questions for Ms. Boland? Comments or questions? No? Co-Chairman Barlow.
Thank you. Thank you for being here. It's always good to see you. So two queries. Behavioral health redesign, we just talked about this WAMSAC versus private practitioners. Behavioral health redesign is, I guess, in effect now, full effect, whatever, a year, I don't remember if it's 12 months, 6 months or 12 months, but anyway, somewhere in there. Do you see a different patient mix now because of that than you did before, because of the priority populations? I'm just curious to see if there's been any impact in your personal experience. I'm not asking to speak for all the practitioners, but thank you.
Oh,
Thank you, Madam Chairman.
thank you,
Boland.
Chairman. Thank you, Chair Ottman, Chairman Barlow. What we have seen are, at least in Carbon County, I can speak to, and my own personal practice. High Country Behavioral Health is our community provider in Carbon County. They have one provisional person, full-time person in the county, otherwise it's telehealth. So what I'm seeing an increase in request of services is for in-person treatment providers. The others are seeing the same. I will tell you that I accept probably 10% of my caseload I don't get reimbursed for. They don't have funding, and I'm not entitled to state funding. So that's just a business decision that I made, was to see the underserved population at no cost. Others can't do that or have decided not to do that, but we do see an influx in that change into the community.
Thank you. Thank you.
Ms. Fullen, I do have a question. As far as community health providers, whether it be in the school, private industry, or whatever, who has the authority to prescribe behavioral medications?
Thank you, Representative Ottman, Chairwoman Ottman. The prescribers start with a psychiatrist. They're at the top of our pyramid from behavioral health. So a psychiatrist is a medical doctor. Family practice, MDs, DOs can prescribe, and then nurse practitioners. That's, and physician's assistants. So anyone with a medical degree can prescribe in our state.
Okay, and as a follow-up, so is it your experience, or do you know, if these things are prescribed? Because a lot of times we're given a prescription that said, if there's any problems or anything, please come back. What is the follow-up procedure for these? Is there a mental health person that follows up with these, or is it just on the patient, or do you know? Or how can I find out?
Thank you, Chairwoman Ottman. So it really depends on the prescriber. I do have a couple of family practice docs that just prescribe the meds, and you go, parents are able to call, or individuals can call if there's a problem. One of the challenges is that people don't always know what a problem is. And many of the medications are kind of hit or miss. So it's take this for 3 or 4 months and get back with me to see if you're still having any issues. Our family practice clinic in Rollins is really good about following up. That one of the medical assistants will call a parent to see how a child is doing on their meds, and adults as well. So it's really hit or miss. It depends on the provider, the prescriber.
Thank you. And if I could just ask Ms. Gordy, what, and does this concern you guys, like, would that be a confidentiality thing if I said, okay, this child is now taking this for behavioral things, we're going to see how it goes, and then I said, I want to know through the teacher, what you're seeing. I want to know if there's been any principal referrals, if there's, and what are side effects and all that. Is that would you see that that's a confidentiality thing, or do you know?
Madam Chairwoman, do you mean with regards to the Department of Family Services or solely within the schools?
Ms. Corey, since nobody's really here to say about just a child that isn't in family services, so yeah, through the department.
If I'm understanding you, I think if the department was involved with this family or this child, we would still not be able to share any information with the school as it would relate to the open case of that child.
Thank you, Chairman Barlow.
Thank you, Madam Chairman. I think when we start talking about prescriptions and medical, we're also talking about HIPAA. We're also talking about federal privacy that goes above and beyond what even the Department of Family Services they can't even overrule that. So probably just Director Johansson or our resident healthcare professional could speak to that better, but I think we're really talking about two different things. HIPAA potentially with prescription type things, and then other protections or state-based. But anyway, thank you. Maybe my good colleague, Ms. Brennan, would speak to that. Thank you.
Senator Brennan?
Yeah, thank you, Madam Chairman. Just a couple of kind of comments, thoughts along your questioning. When we look at these medications and what the follow-up looks like, sometimes it depends on the class of medications that is being prescribed. So there are certain classes of medications, stimulants is one that comes to mind. Those you automatically have to follow up with a physician or whoever the prescribing provider is every 3 months to be able to get those refilled. There's going to be other medications that aren't that often. In my experience, a lot of clinics, they will ask you to follow up every 6 to 12 months on medications. A lot of providers, I think, sometimes a little bit earlier than that if they're starting somebody on a medication, but usually a minimum, you'd have to follow up at least within a year, I believe, because you have to have that appointment with the physician to be able to check you and say, yes, you need this medication for, X amount. They can only give you so many refills before they have to see you in the office in that timely manner. As far too as the questions when you get into HIPAA and then seeing how does a child act after certain medications, a lot of times too with specifically like your stimulant type medications, they will ask the parents and the teacher to fill out like evaluations on how the child's behavior is. And that helps them in determining, do they have the correct medication and do they have the correct dose of that medication? So some of these, especially the highly regulated medications, there is a lot of collaborative work going on and looking at what is the child acting like at home, at school, and just kind of across those spectrums.
Thank you for that. And I guess that's where I'm going with all of these things is collaboration, not to squelch anybody's rights, but to say the collaboration for this individual is so very important. Did you have anything else?
If I could follow up, Madam Chair, with Senator Brennan's comments. As a practitioner, as a provider, I ensure that I have a signed release by the parents whether to be able to speak to DFS, whether there's a case or not, to be able to speak to the school. So I have to have a separate release for each entity that I need to collaborate with. And I will, just as part of my practice, on a monthly basis, I contact this, our pediatric nurse practitioner who sees most of the children in Carbon County, and she and I staff our cases. So I'm explaining to her the behaviors that I see because I am seeing the children more frequently than she does. If there is a problem, then I am usually the one that's making that contact to the prescriber to say, we've got something going on. And then I get a release from the school as well, to talk to the school counselors, to talk to the principal and the teachers. So there are a lot of pieces of paper that I am required to have for a single child, for anyone that I need to be able to speak with. And collaboration is the actual key to helping children. It's not in a silo. It is all of us as a community working to help the children.
Thank you for that, Ms. Follen. Any other comments or questions? Any other public comments? We have a couple online.
Thank you.
Oh, yes, please, come on up.
I don't know if you could hear me, but I wasn't going to speak. I was just going to listen to what some of the priorities are going to be. I'm from Cheyenne, Wyoming. I'm a former elementary principal. And so just listening to these two presentations, I had some thoughts. I've been retired for about 5 years. I think our schools do an awesome job of trying to take care of the whole child. And yes, teachers' plates are full. We've had a couple of behavioral programs instituted, and I think if you talk to any teacher, there's several behavioral programs that are instituted, then they die out, then they're instituted, then they die out. So I get well worried when there's a program recommended for a district or in a grant or anything like that. Teachers tell me, and I as a principal, we need the mental health counselors. I don't want to rain on the private practitioners. I'm a school social worker in my trade too. We need them and we work with them. Our social workers usually meet with the mental health people. So my plea is that we need the counselors at the school level. Teachers are overworked and they're awesome people, but they cannot deal with some of these issues. They're also, the counselors will help make those referrals. The counselors will be on their I think they were called BIT teams, the behavior intervention teams. It's been about 6 years since I've been out. So I just really worry when we say we're going to go with this prescription program. I worry that we say we don't need mental health practitioners in the schools. We need them. And if you talk to teachers, they'll tell you we need them because they're good at teaching, but that they don't know how to do some of the other things. And they weren't trained for that. So that's all I had to say. Oh, no, my last thing. I'm from a Title I school. Our kids deserve the right to be fed 365 days a week. And it's a shame if we cut programs from our kids, especially the low-income kids. Those summer programs, you go to the Y, you can see them being fed. They're at the Y. You go to Cole Elementary, you can see they're being fed. Our kids have the right to be fed 365 days a week. Thank you, Madam Chair.
Thank you for that testimony. Is there any questions for, is it Ms. Gregorio? Gregorio, any questions?
Just a statement. Thank you.
Thank you very much. Okay, anyone else? Did you say going once, going twice?
Say it however you like.
Okay, there we go. Okay, was there online? No online? Well, I guess we'll close that section and go to the past bills. Is that where we're at?
Thank you, Superintendent. Thank you, Department of Education. We
Yes, thank
appreciate you.
you. Bye. Okay, let me see. Okay.
Anna can walk through those individually if you want.
Yes, I would. Okay. As we see, number 6 here, and let me see, we are ahead of schedule, so that's wonderful. Anna, would you please provide the information on this, walk us through these bills? Thank you.
Absolutely, Madam Chairman. I am just going to give a quick summary of all these bills. If anybody wants me to describe them further or in more detail or has questions, then please just stop me and I'd be happy to answer any questions the task force might have. First, we have 24 LSO 15, which was entitled Vulnerable Adult Definition. This bill didn't actually make it out of the task force, but it was something that the task force had looked at a couple years ago. If the bill was enacted, the definition of vulnerable adult would read that a person is a vulnerable adult if they lack the capacity to consent or who is unable to provide for their own care or protect themselves from abuse, neglect, exploitation, intimidation, abandonment, or self-neglect due to a physical, emotional, developmental, or mental disability. The effects of illness, injury, or accident, or residency in a nursing home or similar facility. Then moving on to 24 LSO 145, which was Vulnerable Adult Counsel. This bill also didn't make it out of the task force. This bill draft would create a Vulnerable Adult Council, the purpose of which would be to make legislative recommendations on whether to consolidate all state resources for vulnerable adults under one state agency, namely DFS, or more than one state agency. The council would also make recommendations on other issues surrounding vulnerable adult caseloads and adult protective services. 24 LSO 192 was guardianships and conservatorships letters of termination. If enacted, that bill would have required guardianship and conservatorship letters to be renewed annually, along with the filing of guardian and conservator reports. Guardianships and conservatorships would terminate if the guardian or conservator failed to file a guardian or conservator report annually. That bill also didn't make it out of the task force. This next bill, which is 25 LSO 4, DFS confidentiality amendments, died in committee during session. This bill would allow the director of DFS to share data with other agencies and entities for the purpose of individual case planning and decision-making, policy analysis, program evaluation, performance measurement, and participation in bona fide research and integrated and longitudinal data systems. 25 LSO 30 didn't make it out of the task force either. It was entitled Title 25 Costs. The bill draft essentially shifted the burden of paying for the first 72 hours of Title 25 detentions from the applicable county to the Department of Health. The applicable county would then repay the Department of Health at the standard rate set by the department for the costs of treatment incurred by the department during the first 72 hours of detention, including medical treatment. 25 LSO 216, which was Advanced Healthcare Directives Dementia, did pass out of the task force and went as an individual bill, but wasn't introduced on the floor during session. This bill draft amends the definition of advanced healthcare directed to specifically include directives for dementia. The definition would include all dementia directives to provide individual instruction for healthcare decisions to address the gradual cognitive decline of a person who has been diagnosed with dementia. And then 25 LSO 450 died in committee during session, and it was called K through 12 Mental Health Program. And this bill draft would create a program to address the mental health needs of K to 12 public school students, which would basically be based on Project Aware. The program would last for at least 2 years, and school districts would be required to report to the Department of Education regarding various data points. And it should be noted that during last session, funding was given to the Department of Education on a pilot program basis for this exact purpose. So there is money there until 2026. And I would stand for any questions. I would describe these bills further if anybody needs more clarification. Thank you.
Madam Chairman.
Thank you very much, Anna. Yes, Director?
Thank you, Madam Chairman. Anna, Could you say again, I just missed it, on 25 LSO 216, Advanced Healthcare Dementia, Directives for Dementia, what was the outcome of that?
Madam Chairman, Director Johansson. So that passed out of the task force. Representative Larson took it as a personal bill, and then it wasn't introduced on the floor, so it just died.
Thank you.
Department of Family Services, there was quite a bit there. Do you have any comments or questions? Yes, Senator Barlow.
Thank you, Madam Chairman. So actually, I think it might be a good idea to do exactly what you just did, is just, are there any bills here that are particularly of interest to each of these agencies or the courts, and go through, and then we can, maybe that helps us prioritize if the executive branch sees there's a value, and then certainly us as legislators, we can weigh in if there's something of interest, but maybe we start with our executive branch colleagues first and just say, which one of these might be important to you? Do we want to spend more time? And if only one of them rises to the top and we get done with this exercise, then we know where we are. And if two do, we know where we are. So anyway, just a thought. Thank you.
Okay, executive branch. Director Johansson.
Thank you, Madam Chairman. It's rare for the executive branch to get to prioritize bills behind this side of the microphones.
I didn't say they were going to get introduced, Madam Chairman.
Yeah, fair enough. Members of the task force, there's only a few here that either didn't have any action or were not introduced that were relevant to the Department of Health. From my perspective, on the vulnerable adult definition, I think a large part of that bill, so the first one that was on the list, has somewhat been taken care of, and the definition was amended for vulnerable adults to be considered priority populations for Department of Health community behavioral health funding. And so that's, again, a very new reform. It took effect on July 1st of last year. We don't have a whole lot of data on how many of the vulnerable adults have been served, but they can certainly be referred and be considered a priority population for those services. So in my mind, it's a wait and see if there's any further legislative action that would be necessary there. In terms of Title 25 costs, that was discussed pretty heavily by last year's task force, and a lot of testimony from various community players like hospitals. I believe a county attorney or two weighed in. Ultimately, there wasn't consensus on the path forward there. The idea is with that bill to as was already mentioned, transfer the first 72-hour financial responsibility for Title 25 proceedings from the relevant county to the Department of Health. Department of Health.
Director, could you tell me which one we're talking about, please?
Madam Chairman, I can, if I can
Okay.
scroll fast.
Emergency detentions?
Yes, 25
Thank you.
LSO 30. Right now, the Department of Health is financially responsible for all Title 25 costs after the first 72 hours. This bill would have transitioned the first 72-hour county financial responsibility to the Department of Health. And then the Department of Health would charge back to the relevant county a pre-prescribed rate for those services. So essentially what counties would gain is our administrative muscle in the Department of Health. We are good at paying for things. We have systems for that. And so it was proposed as legislation to modify Title 25 statutes in that way. But again, there wasn't general consensus among the hospitals and among the various counties that would be beneficial. I think some would perhaps want to opt in, others would not. At this time, I'm not sure it's worthwhile to move forward with that discussion unless community members, county attorneys, hospitals bring it to the attention of the legislature again. And so I'd hate to waste this task force's time with that topic. Again, could certainly be brought to a relevant committee like Judiciary or Labor Health, should that be desired. Similar with advanced directives on dementia. I think there's standing committees that could consider that as a potential topic, but other members of the task force can weigh in. I have not received requests since the last session for this topic to be considered. So those were the three that were really mostly impactful to Department of Health. And again, I think in the first 2 years, Madam Chairman, of this task force, the taller order items of mental health and vulnerable adults were worked pretty significantly. There was legislation both for the executive branch and the judicial branch that made it to the legislature, was discussed, and some passed. So I think a lot of those items have been worked successfully. The items that were relevant to the Department of Health on this list, in my mind, likely have standing committees that could consider them, and maybe perhaps would not need this task force. Thank you, Madam Chair.
Thank you, Director. Senator Barlow.
Thank you, Madam Chairman. So I just want to clarify, in the behavioral health redesign, we certainly made a priority population out of vulnerable adult. Did we also adjust the definition? And I'm sorry, I just don't recall if we adjusted the definition or not in the context of that legislation. Thank you, Madam Chairman.
Madam Chairman, Senator Barlow and LSO, if you know, correct me if I'm wrong, I don't believe so. So the definition as has been in statute remained. It's the vulnerable adult definition that's currently in statute is automatically prioritized in our behavioral health funding.
Okay, now Department of Family Services, do you have some comments or information on these bills?
Thank you, Madam Chairwoman. If we're looking at the prioritization, there are quite a few bills, obviously, that were probably of interest to us. If we're going to prioritize, I think, obviously, based on the comments we had this morning, it will come as no surprise that it would be the confidentiality amendments. The House bill and the Senate bill were mirror bills, so they were exactly the same. As we heard and what we know, the House bill failed in committee, which was with Judiciary on the House side. The Senate bill did actually make it out of committee onto the floor. So just for a little bit of history of those two bills, as I don't need to probably provide much more commentary than I did probably this morning around why we believe the importance of looking at those confidentiality statutes and the work that we do across agencies for families, it will remain a high priority for us. We do know that when we were at Joint Judiciary, maybe in May, I can't remember all of the dates, one of the senators did bring up that he would like that committee to potentially look at the confidentiality amendments again. Unsure though, however, if that committee is going to look at, it is not a formal interim topic for them. It was just made during conversation.
And, excuse me, would you tell me which committee that was again, please?
Joint Judiciary, Madam Chairwoman.
Judiciary. Thank you very much. Any other comments? Okay. Do you have something, Ms. Butler?
The other branch of government.
The other branch of government, yes.
Madam Chairwoman, I don't believe there's anything on this list that, I mean, we'd be happy to collaborate on any one of these bill drafts, but there's nothing that would be a priority for the branch.
Thank you. Co-Chairman Barlow.
So, Madam Chair, if I could, the guardianship conservator one, that was a lot of discussion last year. And I know we didn't move it forward for good reason, but do you have any, do any of the agencies have any thoughts on that one? I'm just trying to cover every one of these bills by the time we get down the row. So is there any comments on that particular one? And this was really trying to find, Madam Chairman, if I could, for the rest of the committee.
Please.
This is really trying to find a mechanism to hold guardianships and conservatorship, those responsible for some level of accountability to the court. And if they weren't being accountable to the court, then they could be revoked. But what you end up with is, then you have a stranded person, potentially, with no guardianship or no conservatorship in an environment where we're having a tough enough time finding guardians and conservators. So anyway, so that was just for the edification of the folks that weren't on the committee. I think that's at least my understanding of what that was. So I guess, Madam Chairman, if I could, if you wouldn't mind just allowing anybody to weigh in and see if there's another way to look at that, or we just let it go because it is a challenging issue. Thank you, Madam Chairman.
Yes. Is there any comments or information on the guardianship program? Yes, Ms. Butler?
Madam Chairwoman, so I think another piece of that bill really was to try to prevent those who maybe had a previous guardianship from using guardianship like paperwork, so they get an order that says you're the guardian, right? Or letters to that effect. And then that guardianship may be terminated for whatever reason, but they still have that letter, so they could take it to a bank and say, I'm still this person's guardian. And so this was to try to find a mechanism to reduce that kind of fraud. I don't know how often that happens. Ms. Smith may know. But I think where we came to, if I remember correctly, and Anna, if you could help me, that would be great. We did talk with the courts, and specifically it would be the clerks of district court who are elected officials. And I don't know that this seemed to be not quite the right solution to the problem, if I'm remembering correctly. But so I think that possibility still exists. I just don't know that we found a good way to manage it in statute.
And
So
then-
just,
Sorry.
go ahead, Anna.
And then, Madam Chairman, that's how I remember it as well. I think the county clerks had some input on it. They didn't think that the bill was really ready for prime time. If you did decide to go forward with it, it'd probably just have to be brought up during public comment and have a lot of input on it. Because I don't think it was quite ready to go forward, is what I recall.
Okay, thank you. And because it is an issue, I mean, in my family, which is small, we've had 2 incidents of very bad things happening with guardianships. So I know it is an issue. So what would your suggestion be to bring it up through another committee, through a standing committee, through, like Anna said, public comment, through a private bill? What would work?
Madam Chairwoman, I don't know that I know the correct solution. I just am not sure that this bill is it. I think we could potentially look into maybe what other states are doing, or try to determine, again, maybe Ms. Smith has some recommendations on how we can try to prevent that kind of fraud. But I think what we came to is this probably wasn't quite right in terms of approach. And so it would probably need some additional study, whether that's through this task force or a standing committee. Madam Chairwoman, I don't know that I'm sure on that.
Okay, thank you. Any other comments on this?
Director Shannon, have anything?
Director Shannon, do you have something to say? Yes.
Yes, Madam Chair, thank you very much for asking. Department of Corrections has no request for priorities on these past bills.
Thank you. Senator Barlow. Oh, yes. Representative Gugemas, it's good to see you up there contemplating. Do you have any thoughts or comments on any of these LSO passed bills?
No, not really. I mean, which one was it? It was the confidentiality amendments for the Department of Family Services. I was actually on that committee, and I was a no vote on that. I believe I still am. I think it's problematic. So that's. I guess I have no suggestions to promote any bills at this time on this list.
Okay, thank you. Representative? Oh. Representative, do you have anything? Nope. Senator Brennan?
Thanks, Madam Chairwoman. It does sound like maybe we need to look at the guardianship and conservatorship, and maybe, if this wasn't the right bill, and kind of being new to this information, I don't have a solution exactly for today, but that does sound like something potentially. And I will just also comment as far as like K through 12 mental health and Project Aware. That is something that has come up in the Education Committee, and as BAR was mentioned from the Department of Education, which, as the superintendent mentioned, I was able to go visit a BAR school and was very impressed with what they're doing and some of the outcomes that they're having and successes in those. I think that we've maybe got something in Education Committee, hopefully, that will address that need. So those are my thoughts and comments.
And Senator Brennan, just a question from me. So would you say that House Bill 180, I don't recall, Anna, maybe you can tell me what happened with House Bill 180, which was the mental health K-12? The pilot projects were funded?
Right, Chairman Ottman. So the K through Health and Mental Health Program, if I recall correctly, that one died in committee during session. But there was some money that was put aside in the budget bill for a pilot program to do Project Aware in certain school districts. So there is funding for the pilot program through the end of 2026.
Okay. So Senator Brennan, what were your thoughts as far as to continue, or just, what were you thinking, or through recalibration, or?
No, that one, I think we're hopefully going to be able to address that in the Education Committee.
Okay, thank you. There isn't anyone online, is there? Okay, so. Further public comment. Oh, yes.
Good question.
Thank you.
Emily and I came up together. Sam Shumway, AARP Wyoming State Director. This is a big day for me. I think this is the first time that I've sat before a legislative body, and I've been around long enough that I have some institutional knowledge that might actually be helpful to a discussion. So I was just talking to Emily. So this task force actually has been around, different iterations of this task force for a long time. Back in 2016 is when I started with AARP as the state director, and Governor Meade had created an elder and vulnerable adult task force, and with the purpose of examining some of these issues. I want to speak to one of the bills specifically, and it's around the vulnerable adult definition. So and the theory here is that our current legislative language is too narrow. And the language basically says, and I pulled up my notes from back in the day, but it basically says, it defines a vulnerable adult as anyone who's unable to manage or take care of himself or his money, assets, or property without assistance. That's a pretty significant level of impairment, almost something where you would need a guardianship. And the typical victim of exploitation, abuse, and neglect isn't in need of a guardian. They're just have sometimes mild cognitive impairment that makes them vulnerable. And so the discussion started there, and that makes sense. If we need to expand the definition because either prosecutors are not able to prosecute under this current definition because cases are being thrown out where defense attorneys are saying, you don't meet the definition, this is not a vulnerable adult, or if Adult Protective Services is not being able to intervene in a case to protect someone because the definition is too narrow, then yeah, we need to look at expanding the definition so that we're not able to protect vulnerable adults. And so we worked on this. This was in the initial report, the 2017 report, and the initial iteration of this task force included now recently retired Justice Kate Fox. She headed it up. It was a different it was much less legislatively driven and more sort of provider, and AARP was part of that task force. This was not number one on our list of priorities, but there were 12 or 15 different areas where we thought we could do some work. We did, over the intervening 9 years, we've taken this issue of the definition of vulnerable adult to the legislature a couple of different times. And the question would always come back being, do we really need to do this? And we would sort of say yes, and I would give that little spiel that I did around the narrowness of the definition. But then, ultimately I started asking questions to Adult Protective Services and DFS, and I said, are we not able, give me some examples that I can take to legislators to show them, here's an example of somebody who we weren't able to serve. And unfortunately, we weren't able to come up with some great examples. And so I went to the prosecutors, and I went to law enforcement, I went to these organizations and said, give me examples that I can take back. And all of them just kind of said, well, yeah, it could be a problem, but we're not seeing this as a problem. So, long story short, in the spirit of Co-Chairman Barlow's urging that we solve problems and that this task force be focused on solving problems, I'm not sure, and I could be influenced differently, but I'm not sure that the definition of vulnerable adult is really a problem that we need to tackle right now. Because I don't think that definition is limiting what either Adult Protective Services or DFS or law enforcement or prosecutors can do in protecting vulnerable adults. And so with that sort of background, I'll stand for questions.
Thank you, Mr. Shumway. Any questions, comments? Thank you very much. Next.
Hello again. Okay, how about that? I feel like I'm losing my voice, and I'm not even one of the ones talking all day long. Madam Chairman, so I do go back to that
Excuse
original
me.
task force.
Please identify yourself
Oh,
again.
yes, I'm
Okay,
so sorry.
Thank you.
Emily Smith from Wyoming Guardianship Corporation. I've been at Wyoming Guardianship Corporation since 2010. I don't know if I mentioned that the first time. And so I was in many of the original iterations of this conversation, like Sam said. And we do see lots of concerns at Wyoming Guardianship with vulnerable adults and people that have been exploited or abused in some way. And, just to reiterate what Sam said about the vulnerable adult definition, the biggest concern is the definition restricting law enforcement's ability or prosecution's ability to bring those cases forth. And our understanding of that previously was that was not accurate. So I don't know how to fix that piece, but if this isn't going to fix it, I would just say I don't know why we're doing it, except for it sounds good, and I'm not sure that's a good enough reason to move it forward. About the guardianship and conservatorship proposed statute change, we do see, again, like Madam Chairwoman said, people using those guardianship orders that are no longer valid for nefarious purposes. I mean, people do that. And so one reason that I think this was come up with is to stop that from happening, to have those reissued. I think that it is maybe a procedural issue for the courts. I guess Ms. Butler could speak to that, but maybe our courts felt like that was extra work because that's not something that they do right now and maybe not worth the output of that work. I would be interested in finding that out because we certainly as an organization don't oppose that from our end, but we want it to stop the exploitation, right? That's the point. And so I'm not sure what other states do to address that, if they do anything. To kind of bring up what I believe Representative Stiver said earlier is that our statute is very antiquated when it comes to guardianship. If you look at the rest of the statutes in the United States, it's very old. It is not encompassing of what's going on right now with technology and just the way that we view vulnerable adults and guardianship. So anything that we can do to update that is a good thing, in my opinion. The other piece that I think we didn't just talk about is that piece in the proposed statute that has about reporting. One of the things that we actually see way more often is that people haven't reported. And so we oftentimes get cases at Wyoming Guardianship where the guardian or the conservator has not filed a report in years sometimes. For whatever reason, the court hasn't caught that or hasn't been able to catch up with the guardian or whatever is happening there. And so that's also very concerning because if you're not reporting and no one's that mechanism to provide oversight, like we talked about previously when Madam Chairman asked about the oversight. That reporting piece is the mechanism for oversight, right? So that the court can see what the guardian is doing and can ask questions about what the guardian is doing or the conservator. And so if that's not being provided to the court, how are they providing the oversight? So I think that that is a very important piece when it comes to guardian and conservatorship, that there is a mechanism for, if the guardian is not even reporting, the court can remove them and appoint a new guardian if that's necessary. Thank you.
Thank you. Representative Lucas?
Thank you, Madam Chair. Two questions for you, Ms. Smith. And I just want to back up just a moment because I'm not sure I understand the entire process, but the guardianship assignment letters, if you will, that I've seen them at the bank, are those issued by the court?
Yes, Madam Chairman, Representative Lucas, the court issues those letters, yes.
Okay, follow-up. Thank you. Do those letters expire? Does the assignment expire or have to renew periodically, or is it just indefinite until it's canceled?
Madam Chairman, Representative Lucas, that's a great question. We have this question all the time. They are, and I'm going to look at Ms. Butler in case I'm not a lawyer, let's be clear about that. My background is in social work, so I don't know. But our experience is that those do not expire. You would use those indefinitely. And so in the past 5 to 10 years, we have had questions from folks that say, we may have a guardianship from 1998 because we've been in existence since then. And we will ask the court to provide us with current letters. And so the date on those current letters is still going to say 1998, but it will have a stamped raised seal from the court and a initial that will have the current date. So you have to ask for those, Representative Lucas. Otherwise, you're just using that one that just is stamped and sealed from 1998. And so a lot of people are just continuing to use those ones.
Follow-up.
Follow-up?
Thank you, Madam Chair. So it's kind of like a power of attorney then, until the bank receives notice that it has been canceled, it's in power, or it's in effect, but legally it's not. I don't know, that's just something to me that seems like perhaps there should be a recertification or a reassignment on a letter periodically, every couple years, few years, whatever. It's just something to think about. Thank you.
Madam Chairman, Representative Lucas, absolutely, there is a disconnect there, and I think that's maybe a part of what this this particular proposal was trying to bridge that gap.
Okay, and to follow along with that, so what I'm hearing is that there's a disconnect between the reporting. Someone could move, the person could die, whatever happens, but there could be a period of time for, say, 10 years, 20 years where there is not reporting. Because my first instinct was to say, okay, well, what should the penalty be? Well, and it says right here, it says it shall cease. But if the court is not flagging that or knowing that, how's the court supposed to really keep up with that? Do we know?
Madam Chairwoman, ideally, so the statute does have timelines of when reporting is required. So ideally, what would be happening is that would be flagged by the judge or the judge's judicial assistant to review whenever that time frame comes up. I can tell you it's probably not a perfect process because it's a difficult thing to track over time. And if conservators or guardians don't file their reports, it is the judge's chambers who is chasing those people down to say, you have to file your report. So not to say that isn't happening all of the time, but it's likely that there are some that fall through the cracks. I can tell you just based on what I know about other judicial branches across the nation. So our office, the Administrative Office of the Courts, we provide administrative support for all of the courts statewide. So I have a whole team that helps provide IT support, fiscal support, HR support, all those administrative type things. And in other administrative offices in other states, they have a whole audit department that just audits guardianships and conservatorships. And so those reports are audited by people who are experts in those fields. And so they have personnel, they have staff, where the reports will come in to the auditor will review those, do any follow-up. If they don't get the reports, they're the ones who are going back and forth with those guardians and conservators, and then they'll report to, the auditor will report to the judge. And if they see something that is suspect or fishy, then they can flag it for the judge, and they can say, hey, judge, this one looks odd. Maybe you should have a hearing on this, or maybe we should look into this a little bit further. There was one state in particular, and it is eluding me which state that was, but they had some pretty widespread fraud in one of their guardianship or conservatorship companies. I think it was a for-profit company. I don't think it was a nonprofit. And so that's what prompted their state to take those steps. But it would be an investment of personnel, money, resources to do something like that within our branch of government.
Thank you for that. Yeah. Okay. Work
I
to
agree.
do. Work to do. Yes. Okay. Public comment, Representative Stivar.
Thank you, Chairman Ottman. Committee Representative Stiver, House District 12. As a guardian, we have to file every 6 months with the court. Experience, I have an attorney that I pay to fill my paperwork out to make sure it gets in. So we've missed one, and it was not even 3 weeks after we missed it. We got a letter from the district court. They are monitoring. This is just, to me, what this bill does, extend it instead of 6 months, it's every year. And that's why I'm taking this legislation, this proposed legislation, which would be, to me, would be better. But every 6 months, I get a new letter once it goes to the district court, and they approve what we've sent in and why he needs to be kept in guardianship or her. And it's another piece of paper stamp saying you're good for the next 6 months. You have to refile by October 12th. So they are supposed to be doing it.
Representative Stiver, I have a question. So just a point of clarification. So you say you receive a letter and you're timely on your reports, so you're in the system. But you say they're supposed to be doing it, or would you say they are doing it?
I know for me is once that order comes out that your guardianship's extended for the next 6 months, they set a hearing date for 6 months out, October 12th. And you have to have that report back into the district court by October 12th. Like I said, I've missed one time, about 3 weeks off, because my attorney was off doing whatever attorneys do. And it was 3 weeks after that, she got a letter and I got a letter saying you have X amount of time to resubmit this or it's going away.
Thank you for that. Any comments?
Thank you.
Ms. Butler?
Madam Chairwoman, I think the procedure described by Representative Stivar, I would imagine that most district court chambers do have some kind of reminder that they set in their calendars to try to keep track of these kinds of things. Of course, Representative Stivar is a good example of a good guardian, and that is when they send the letter, I don't know that they always get a response, right? And in fact, most guardians are not represented by counsel. They're doing it, for their sister or their brother or their child or their mother. And so they don't have a legal expert to help them with that process. And so whether or not they get a response and what that looks like, I just am not sure. I'd have to go back and talk with the judges.
Okay, and Ms. Butler, not to wear this topic out, but just to clarify, so would it be if we have reason to believe that these things are not happening, or on occasion or not, or certain, maybe there's a one-person office in the county or something, rather than having to put a full-time person on state staff, would it be, could it go through the Department of Audit, or would it be an education thing, like we've done education for fiscal responsibilities within the county offices? Would it be something that maybe just needs retraining, or maybe a lot of them don't even know it?
Madam Chairwoman, I would say the judges know, and so the judges are the ones, it's not the clerks of district court that does the follow-up, it is the judges' chambers themselves. And so the judges and their judicial assistants, they know about the statute, they're fully aware. I think the problem that they run into more often than not is they fail to get a report, they have a reminder, they see that, they send a letter that says, file your report, and then nothing happens. And then they send another letter that says, file your report, and then nothing happens, right? So I think that is more likely the cycle that the judges are seeing. But again, I can follow up with our judges and determine if that's the actual case. But I would imagine that's much more likely, is that they're just not getting a response. And again, I think a lot of it is because those people who are acting in those guardianship and conservatorship roles, they just don't understand the process. They don't understand the legal requirements. And so educating the guardians and conservators, that's a little bit more challenging because they don't live in a county office, right? It could be anybody. It's the public, clearly. So I think that's where we run into maybe the disconnect.
Any other comments or questions? Okay, thank you. Okay. Ms. Bolin?
Thank you, Madam
go ahead.
Chair. Cheryl Folland, LCSW in Rollins. I'd like to speak specifically to that 25 LSO 0450, which is the K through 12 mental health program. You've asked, Chairman Barlow asked for solutions. Chairman Barlow asked for solutions earlier. I have a solution for this, and it doesn't cost anybody any money. Allow community providers to provide services within the school system. It's simple. I did it when I was living in Casper in Natrota County. They actually had offices for community mental health providers. We had our kiddos that were referred to us. Each of us had designated times that we could see our clients. Most kiddos you only see for about 30 to 45 minutes. Their brain can't handle any more than that. And it's relatively simple. We have set processes in place for confidentiality. We get the appropriate signatures, but we also need to bring the parents to the table. That's one of the things that currently does not necessarily happen with Project Aware. And the challenge is children are dropped off like laundry. Parents drop them off, parents, guardians, DFS, caseworkers drop them off. They do their session and they're picked back up. When you have a person that's in the community, whether it be through the community behavioral health centers or private practice individuals, we have flexibility. We have the opportunity. Provide us an office. We can sign up on a schedule. We maintain our confidentiality. I'm a keeper of secrets. That's what we do. It also negates any additional funding by the state, by taxpayers. We have solutions. We don't need the state to pay for solutions. We have the solutions. So I would encourage this bill to be set aside until perhaps we can have conversations with labor and education on what makes sense. I know that the Department of Education is worried about losing the SAMHSA funding. There's other additional funding, is my understanding, from the feds is going to be coming down. We just changed fiscal years. Allow that to occur. I don't have a problem with that. But taking and spending taxpayer dollars on something that can be easily solved within our areas. That's what I'm encouraging this task force to do. Put this at the bottom so we can have those discussions with people from private practice, not just state agencies and entities. Thank you.
Thank you. Any comments or questions for Ms. Voland? Co-Chairman Barlow.
Thank you. So I think we heard something very different from some of the other folks that were testifying. I just want to point this out, is some folks don't want services provided in the school setting or in the school buildings. So I just point out there's a natural tension within this discussion about that. The other thing I would respectfully point out is you're in one school district. There's 48 school districts in the state of Wyoming. Some of them are 100 students in a community that has less than 100 people in it. They don't have, they may not have folks in their communities. So I think you have to think about the delivery system is not the same in every community. So I think we have to at least be cognizant of that. There are different communities have different opportunities and different limitations. So I just throw that as a comment, but if you want to, if there's a feedback, that would be great. But those two things come to mind. Thank you, Madam Chairman.
Ms. Voland?
Madam Chair, Chairman Barlow, I absolutely agree, which is why it should be the communities who decide, not the State Department of Education. If there is a need, and I have practiced in Natrona County, Uena County, and now Carbon County, and I have connections throughout the state. We have these conversations as private providers at conferences. And anytime that we do get together, we do have these conversations. And I was one of those I'm not a fan of the schools providing the social services. That's why if you just give us an office, or we ensure that there's transportation to an outside office, we have options available that minimize these costs. My encouragement is, and I've been in Meeteetse, there's occasionally, I specialize in certain areas. So there's times where I drive to provide services to communities who do not have someone local, like Meeteetse or up in Pinedale, that don't have my expertise in what I work with children. And so you're absolutely correct, but those discussions need to be held internally in the communities, so it's not every district shall, which is what this bill does say. But then it does also say that school districts can opt out. Instead of getting that far, having the discussions of what can we do that minimize those costs.
Thank you.
Thank you. Thank you. Any other comments or questions? Okay. Committee directives. Oh, I'm sorry. Further public comment? Everybody's commented out, huh? Is there anyone online? Nope. Nope. Co-Chairman Barlow.
Thank you. I just want to follow up ask a couple more questions on the guardianship conservator topic. And I'll direct these, I think, mostly to Ms. Butler, but certainly anybody else that might have information to weigh in. One, is there a repository for guardianships and conservatorships in the state of Wyoming, or is it district court by district court? Is there a uniform depository, or is it just district court by district court? That's my first question. And the second question is, and I know that the district court is not under the Supreme Court, but is there a way for court rules to actually, the court to have rules to address some of this reporting and responsibility that district courts could do? Or maybe the district court council, could they adopt something in that realm? So those two questions, one, a repository, or do other states have it if we don't, which I don't think we do, but is there, and two, is there a way for the court themselves to uniformly address this? Thank you, Madam Chairman.
Ms. Butler.
Madam Chairwoman, Mr. Co-Chair, so we don't have a repository for just guardianships and conservatorships. What we have to manage all of our case records it's our case management system. Our case management system and all of our trial courts is the same system. It is the database in which it lives is kind of sectioned off a little bit, but we could pull data statewide on specific things. Whether or not, in fact, I know this to be true, we cannot, I don't believe right now, just pull up a list that says these are the active guardianships in Wyoming. And mostly because that's document driven as opposed to data field driven. So that makes pulling that data much more challenging. So that is something, I know I've actually talked to Ms. Smith about this a couple of times. We've tried to work through different mechanisms where we could make something like that happen because, the chances of fraud are one thing, but also, you have somebody in an emergency room and you need to figure out whether or not they have a guardian, right? And that happens. And there's no way for the hospital to look it up and say, yep, this is the person's guardian, I need to call them, right? So we know that that's a challenge. We know it's something we've looked into a couple of different times and we'll probably continue to work through. To your second question about whether or not the court could come up with some rules, I think probably it could. It would be in collaboration with district court judges, probably district court clerks as well, to determine what that could look like. Also would probably want to work with somebody like Ms. Smith or somebody who has a good amount of experience in the guardianship, conservatorship world to come up with some language around that. But that's definitely something I can take back to the Judicial Council and have a conversation about.
Thank you. Representative Stivar.
Thank you, Chairman Ottman, committee. Ms. Butler is absolutely right. There is no database. I worked with Protection Advocacy on this, and Representative Stiff was looking at it, trying to figure out how we could do this a couple of years ago. But as of this time, there is no database.
Thank you, Representative. Any questions or comments for Representative Stivar? So what I would wonder is, should we wait on information from the Judicial Department, or what does that look like, Ms. Butler?
Madam Chairwoman, I think it's up to you and up to this committee on how it wants to proceed. I'm happy to take these questions back and talk with, our council and determine, how the branch would like to move forward. And I'm happy to bring that information back to you. I don't know in what timeline. I'll have to think through that and see what kind of information I can get back. So I can't give you an exact timeline, but I would say in the next month or two, I could probably have some information back for you.
Thank you. Co-Chairman Barlow, any directives?
I think, Madam Chairman, I think we just walk through these bills, and if there's anybody that wants to flag a bill, or these bill drafts, flag a bill draft, that's a high priority, we can have that conversation, and if none rise to the top, then we know where we are. We maybe have some follow-up information from the courts on one particular issue, and maybe there's some others. I think we could, if the confidentiality one, we want to just send a letter to, if nobody, we don't want to take it up as a bill, we want to encourage the Judiciary Committee to take it up, since apparently it's been presented to them, we could send a letter to them. So I think we want to get to directives or actions those are the kind of things. But I say, Madam Chairman, we just walk down the list and go through them, and if there's nothing rise to the top, and we just want to take a few intermediate actions of encouragement to the judiciary branch and, encouragement to one of our standing committees, that's where we end up, that's where we end up. So that would be my thought, is just walk down the list, and we want to do this, and nobody advances it, and we don't have a strong consensus, we want to move it forward, we move on. The last thing I'd say is, just to be clear about where we are in this process, is, as I mentioned earlier when we started, we can't actually sponsor legislation. So this has to go to another committee, what we would advance. We're going into a budget session, requires a 2/3 vote in whichever house it starts. So I think we just have to be realistic about process things. If it's something really important, then we should absolutely advance it. But if we don't have a strong consensus within our group, then I think we should be cognizant of that and probably not proceed. So thank you, Madam Chairman.
Thank you, Co-Chairman. I would come into agreement with that, but I would also say is that what I have found is that when this committee was formed in March of '23, there were a few issues. The first was law enforcement cross-reporting, and I believe that that ended up being House Bill 27 and was passed. Then there was also the Judiciary Committee took up a bill about vulnerable adults in distress, Department of Family Services, HB 5. Does that make sense? Or is that anything? And then thirdly, let me see, Emergency Protective Services extend period, which we just talked about. So there was some specific reasons that the committee was formed in '23. And so going down through these bills, I would suggest in agreement that we look at what we can offer up as additional information and things that went on today. And if we can be of assistance to the standing committees, that we would do that. So is there any other comments or thoughts on that? Representative Gugemas? Okay, thank you. All right, so as we go down through there, should I just read them off, or would we like LSO to do that again?
No, just one at a time.
Just one at a time. Okay, 24, LSO 15, vulnerable adult definition.
So, Madam Chairman,
Chairman
the
Barlow?
question is, does anybody on the committee feel this is strongly that this is something the committee or the task force should continue with?
Yes.
That's the inquiry, okay.
Yes. Okay, does anyone feel strongly that this is a bill that we want to take? And honestly, there's things, I mean, in my mind, there's things that we think, we can't put these things off for a year, but when you look at the budget session coming up, that's the reality of it. So if we can support the standing committees and offer up work that we've done that they won't have to do, I think that that would be advantageous. So anyone with a vulnerable adult definition feel strongly that we should move forward with that? Nope. Okay, 24 LSO 145, vulnerable adult counsel. No? 24 LSO 192, guardianships and conservatorships, letters and termination.
Madam Chairman?
Yes.
Madam Chairman, I think we can do this informally, but Ms. Butler's already said that she'll take this to Judicial Council and that, so I think that's good enough. If there's a kind of a consensus within the group that we would like that to occur, I don't think we need to send a formal letter or anything. She's a member of this task force and we'll carry that out.
Yes.
So I'm certainly not interested in continuing with this bill. I'd like to see if maybe the judicial branch could actually help resolve concerns here. So thank
And
you,
we
Madam
would
Chair.
like a report back on what you've done.
You got 2 weeks.
Madam Chairwoman, I'd be happy to report back. 2 weeks may be a little too quick.
You can just say no report.
Thank you. Yeah. Okay. Let me see, 25, LSO 4, Department of Family Service, confidentiality amendments.
Madam
Chairman
Chairman.
Barlow?
Madam Chairman, I do think this is an important conversation to continue. However, I'm going to respectfully suggest that either you or I or both of us just reach out, and I'll be glad to reach out to our judiciary co-chairs and just ask them if they're going to take this up. And then if they say, yes, we're working on it, we're trying to figure out a path forward, you and I just individually can cross this off the list.
Okay.
Is that fair?
All right, and
Thank you.
so you and I will be in
Yeah,
conversation?
I'll just holler at them both.
Good, okay.
And maybe, actually, we'll ask Anna or LSO to just help us, remind us to touch bases and maybe generate that email. Thank you.
Okay. 25 LSO 30, emergency detentions, hospitalization costs. This was the 72 hours and the Department of Health. So let me see, I have so many notes here, Director. That bill, you were working with the counties because of the 72 hours that is not in place yet, and so you want to continue that with the counties?
Madam Chairman, thank you. I don't think there's a need to continue that piece of legislation with this task force at this time. Those topics come up periodically, maybe driven by a county or sometimes disputes between counties on who owes whom what for Title 25 costs. I will say that both in terms of state hospital issues, Title VII in jails, Title 25 costs are certainly part of that. The Judiciary Committee has made Title VII in jail and state hospital issues an interim topic. So there's certainly an avenue, if it comes up, where a standing committee could potentially consider that. But if it does come to our attention where either providers or counties are proposing this solution, I'm happy to report back to the committee. But I think the task force last year, I won't speak for the group, but was on it. And from my recollection and memory, the reason it didn't move forward is because there was no really driving force behind this as a solution to a problem that the communities and the counties want and the hospitals want right now. So it was tabled without even moving out of the task force. And Chairman Barlow, I don't know if that's your recollection as well, but that was certainly mine.
Thank you. Chairman Barlow?
Thank you, Madam Chairman. So in 2015, we have a Title 25 task force. Then Director Forsland was on that task force. I was a member of that task force. Robin Cooley, who's now Judge Cooley, was a member of that. I think she was maybe with the court at that time. I can't remember who she represented at that time. County commissioners were on that, et cetera. So that went for at least 2 years and maybe 3. The only solution that the communities would really like is for the state to pay all of Title 25 costs. There is no, we pay, you pay, we pay us, there is no repayment thing. So, and I've made that proposal several times in the legislative setting. It's not gone anywhere. So while this is just a shuffling of the chairs on the deck, in my view, as far as this particular thing. All it may gain, this particular process, is the buying power of the Department of Health, the negotiating power of the Department of Health, and I'm not sure that's a good enough reason. Well, for me, it's not a good enough reason to move it forward. The only reason to move something forward is you're going to say, okay, counties, the state of Wyoming is going to take responsibility for this, and we don't have the will, we're not getting to get there. So anyway, so this has been a long, ongoing conversation I've literally been involved with for 10 plus years, and I don't think there's a path forward, and this bill certainly isn't that path. So thank you.
Thank you, Chairman Barlow. Director?
Madam Chairman, I would have nothing to add. I agree with that. It's been looked at from time to time for Department of Health to take over all of the Title 25 costs. That comes with pros and cons. Pros is the administrative simplicity that we would offer, where counties don't have to bill or collect revenue for those services. The downside, which any good county government official would tell you, is that when Department of Health takes things over, we set rules, and not everybody is happy with those rules, those rates. And also, quite seriously, the flexibility that counties have to negotiate their own solutions with providers for Title 25 detainees. So it's certainly a mixed bag of pros and cons there, but I agree with Chairman Barlow that it's been looked at from time to time. I don't think there's a viable vehicle right now to solve a problem.
Okay, thank you very much. All right, next we have 25 LSO 216, Advanced Healthcare Directives for Dementia. Department of Health, again, I didn't really. Here, go ahead.
Thank you, Madam Chairman. So actually, there was Catherine Wilkinson, who represents the Alzheimer's Association, reached out to me before the meeting, said we're still not favorable to this bill draft, which doesn't mean that we should just drop it just because she doesn't, or they don't like it. But I do think there are some challenges with it. I'm actually working with Ms. Wilkinson, and there's an association of estate planners isn't the right word, but of attorneys who actually deal with this type of thing. And I'm working with one of those attorneys and Ms. Wilkinson. I think there's a way to actually take a little different approach. And if they come to some kind of understanding, I'll bring it as a personal bill. Somebody will bring it as a personal bill. So it's going to take a little bit of time, and this bill is not ready for anything. So this is not a high priority.
Okay, was there any other comments on this bill? Okay, thank you for that. 25 LSO 450 K-12 Mental Health Program. Senator Brennan, you had some comments on that, and we've heard quite a bit about it from Ms. Foland and Ms. Smith. So we were talking about setting aside and talking to labor and education, and leaving it up to those departments because that's, I believe, on their agenda, right? So is that the general consensus? Okay, any other comments, questions?
Madam Chairman.
Yes.
Madam Chairman, I would say that we both have Education Committee and we have recalibration, both that are intersecting in this space. So to me, I don't want to duplicate or try to get in the way. They're going to be meeting monthly, I think, or maybe even more often on recalibration. So, this topic will keep coming up, and I'm confident the advocates that are here and elsewhere will be at those meetings and interested in what the recalibration does, and which, just by the way, to remind this task force is, the courts have said, you better pay attention to this in that ruling. So I think they have quite a bit of motivation to at least attend to the issue, how they resolve it, that's a different issue, but I think they'll actually take it up. So thank you, Madam Chairman.
Thank you, Chairman Barlow. 25 LSO 758, Department of Family Services confidentiality amendments. We've heard from Representative Gugemas that he thinks that this is something that we should not take a movement on. Also, the Department of Family Services was saying no.
Madam Chairman, this is a repeat of the first of 192 from above. So I think we have an understanding that the there were two bills in this past session. That's why it's on here twice.
Oh, that's right.
But
Okay, Senate
Madam Chairman, if
file
I
and
could,
House
I think we understand that you and I will reach out to
Yes.
the Judiciary Committee and see what their appetite is. If they're going to take it up, then I think that is the appropriate
Okay.
avenue, and we'll leave that be. Thank you, Madam Chairman.
All right, what I will say too is, this seems like it was kind of an exercise in futility, but what I will say is that I believe that it was very educational, and I believe that the conversations were good. I appreciate each one of you that have spent your day here today, because the information and the concern across the state is very, very valuable. So I just wanted to thank you for that, and
Thank you. And Anna, is there anything that we need to get from staff? Thank you, Madam Co-Chair. Anything that you have?
Mr. Chairman, no, nothing further.
Okay. Was there anything further in the Management Council directive besides reconvene and see what happens? And I apologize, I don't recall what their actual directive was. If they had anything specific.
Mr. Chairman, I don't think so. Let me look really quick, but I don't believe so, no.
Okay, all right, thank you.
well, I believe Senator Co-Chairman, Chairman Barlow, that the executive branch really wants to be here October 13th, so we're going to have to come up with something.
Are you going to take a vote on that, Madam Co-Chair? We're block voting. So, Madam Chairman, and subject to Anna telling us something about the Management Council directive, which I apologize, I should have Go ahead, Anna.
Mr. Chairman, I don't believe there's anything further, not that I recall, not that I
Okay.
see anywhere else.
Okay, thank you. So what I think, Madam Chairman, if I could just summarize where I think we are as a task force, I don't think that, we can certainly leave this August 13th date on the record, on the calendar, and hopefully by that time, we'll have some feedback from the judiciary branch, and we'll certainly know if our judiciary committee is taking up the other two. So anyway, if there's anything there, I would like to make the call that we won't have this meeting at least 2 weeks in advance. So anything we can do to have that, so clear up folks' schedules. And we can always have another meeting later in the fall if we decide we need to do something. But at this point, we can leave this as a marker just to keep everybody moving. But I would anticipate that this goes away and maybe we think about it one later in the fall if there is something that comes up. Anna, and I think the co-chair and I, just for the members of the task force, the co-chairs and I will visit, and we may actually formulate a letter to go to management council saying, we've reviewed the priorities, we've took testimony, we don't think there's anything that this committee at this point or this task force can advance. It's meaningful, but we would await any further, if you had further direction from us, we would accept that. Does that make sense? That would be my recommendation, Madam Co-Chair.
Any thoughts or discussion on that? I would call this adjourned, right? Meeting adjourned. Thank you.
Thank you. Well done.
Oh, thank you.